Welcome to today's lecture on radiation safety in radiology. In this comprehensive script, we will delve into various aspects of radiation safety, including optimization of imaging examinations, dose reduction techniques in different modalities, and radiation protection in various radiology and nuclear medicine procedures. We will also explore methods for reducing radiation exposure in pediatric patients, advanced techniques for radiation dose estimation, and emerging technologies for dose reduction. By the end of this lecture, you will have a thorough understanding of the principles and practices of radiation safety. So let's begin. Radiation safety is of utmost importance in the field of radiology to ensure the well-being of both patients and healthcare professionals. It involves minimizing unnecessary radiation exposure while maintaining optimal image quality for accurate diagnosis. This requires knowledge of radiation physics, the biological effects of radiation, and adherence to proper safety protocols. One fundamental aspect of radiation safety is the optimization of imaging examinations. By selecting appropriate imaging modalities and protocols, scanners can be adjusted to deliver the minimum radiation dose required to obtain diagnostic quality images. This involves considering patient factors, such as age, size, and clinical indication, as well as technical factors, such as tube current, voltage, and image acquisition parameters. Radiography is a common imaging modality that utilizes ionizing radiation. To ensure radiation protection, radiographers must employ shielding measures such as lead aprons and thyroid collars. Additionally, proper positioning techniques and the use of appropriate exposure factors help reduce unnecessary radiation exposure to patients and operators. Fluoroscopy is a dynamic imaging technique that exposes patients to continuous radiation. To minimize dose, pulsed fluoroscopy and last image hold techniques can be employed. Additionally, collimation and beam filtration assist in reducing unnecessary radiation scattered to the patient and operator. CT scanning involves higher radiation doses compared to conventional radiography. To manage dose, CT manufacturers have developed various dose reduction technologies, such as automatic exposure control, iterative reconstruction algorithms, and organ-based tube current modulation. Proper patient selection and justification of CT examinations are also vital in minimizing unnecessary radiation exposure. Interventional radiology procedures often involve prolonged fluoroscopy and high radiation doses. Radiation safety measures include the use of lead shielding, protective eyewear, and radiation monitoring devices. Proper training in radiation protection techniques and the implementation of dose tracking systems help ensure safe and optimized procedures. Nuclear medicine imaging employs radiopharmaceuticals that emit ionizing radiation. To protect patients and staff, strict adherence to radiation safety guidelines is crucial. This includes appropriate handling, storage, and disposal of radioactive materials, as well as the use of shielding and distance optimization during imaging procedures. Children are more sensitive to radiation, and efforts should be made to minimize their exposure during imaging. Pediatric protocols with reduced tube current and voltage, as well as size-specific dose estimation techniques, are employed. Additionally, the use of immobilization devices and gentle restraint techniques help ensure image quality while reducing radiation dose. Accurate estimation of radiation dose received by patients is essential for appropriate risk assessment. Advanced techniques, such as Monte Carlo simulations, anthropomorphic phantoms, and patient dose tracking software, aid in estimating radiation dose to target organs and tissues. This information allows for better optimization of imaging techniques and patient-specific dose management. Radiotherapy involves the deliberate use of ionizing radiation to treat cancer. Radiation protection in this setting focuses on shielding measures, precise treatment planning, and quality assurance programs. Regular testing of radiation equipment and implementation of the ALARA, as low as reasonably achievable, principle ensure that the therapeutic radiation dose is delivered accurately while minimizing exposure to healthy tissues. Molecular imaging techniques, such as positron emission tomography, PET, and single photon emission computed tomography, SPECT, employ radiotracers for functional and molecular imaging. Optimization strategies in molecular imaging include the use of shorter-lived radiotracers, hybrid imaging systems, and advanced reconstruction algorithms to minimize radiation dose while maintaining diagnostic accuracy. Advancements in technology continue to drive innovations in radiation dose reduction. New imaging modalities, such as digital tomosynthesis and photon counting detectors, offer improved image quality with lower radiation doses. Additionally, artificial intelligence algorithms can aid in optimizing imaging protocols, reducing unnecessary imaging, and improving image quality. In conclusion, radiation safety is a critical aspect of radiology practice. Through optimization of imaging examinations, dose reduction techniques, and adherence to radiation protection guidelines, healthcare professionals can deliver high-quality diagnostic and therapeutic radiological services while minimizing radiation exposure to patients and staff. Continued education, research, and technological advancements play key roles in ensuring the ongoing improvement of radiation safety practices in radiology.